administration, we have seen changes to COVID-19 vaccines recommendations, with the FDA limiting vaccines for many Americans back in August and vaccine recommendations being changed this month by Health Secretary Robert F. Kennedy Jr.'s vaccine advisors. Thanks for joining us tonight. Fox 14's Princess Bryant sat down with a local doctor to hear more about the vaccinations and how you can make that decision for you and your family. That story is first on Fox Tonight.
Since the pandemic 5 years ago, it has been encouraged for the community to take the COVID-19 vaccine as a routine step during the fall, similar to the flu vaccine. Dr. Rodney Young, Texas Tech Physicians Family Medicine physician, says that although the vaccine during the pandemic brought down the spread, the virus is here to stay.
We won't be able to stomp it out with the vaccine, and its behavior is likely to be more along the lines of what we think about with influenza, where every year it's there. It'll surge during respiratory times, or there'll be periods where there's just a lot of it and it spreads more easily. And that's what the vaccine we're using now helps us to mitigate against.
In August, the FDA approved updated COVID-19 vaccines, but limited the use to seniors and younger adults or children with a high-risk health condition.
Age alone can create some degree of frailty. Our immune systems just aren't quite as good when we get enough birthdays in the rearview mirror, and so there's more vulnerability associated with that. But on top of that, you have people develop conditions like diabetes, heart disease in some form, chronic lung diseases like asthma, COPD, or others, and those folks have a real risk.
Most recently, it was announced vaccines will no longer be recommended for any group, but rather a personal decision. Dr. Young talks more about how each person could be best informed.
Being properly immunized has saved millions of lives over the years, and our vaccines are very well tested and very safe. So if you're interested in that conversation, go and visit with us or go and visit with the pharmacist about possible benefits for those vaccines.
Dr. Young asked that there has been research done for COVID vaccines for decades. He explains that nothing has zero risk associated with it, but benefits for the vaccine outweigh the risk for most in the population. Live in studio, Princess Bryant, Fox 14 News. Jack.
Princess, thank you. Dr. Young says that the American Academy of Family Physicians and the American Academy of Pediatrics have not changed their recommendations, so he encourages everyone to talk with their physician to see the best fit for them. A pastime activity may lead to cognitive